Not everybody wants to go under the knife, but they want to look better. So what can you do? What can you do? So we went to Crystal Young, who always looks good. I don't know what she's drinking, but it's working.
Now I got a little pact with the devil. Okay, I'm kidding. I'm kidding. So this morning we're talking about a procedure called Morpheus, and I think it has become so popular because it combines two things that are already popular. Microneedling, which you may have heard about, that falls into the category of don't try it at home, and the energy of RF or radio frequency. It's called Morpheus. Take a look. For Dr. Marina Pareto and her son Andrew, you could say great skin runs in the family. As a dermatologist, she sees patients for a variety of skin conditions. This one is getting shots of Daxxify to stay smooth and wrinkle-free. But Andrew, who knew at a young age he wanted to follow in his mom's footsteps, decided to be a plastic surgeon.
My mom's been my boss my whole life, and now she continues to be. But it's wonderful because we complement each other wonderfully. She is a dermatologist and has certain tools in her belt, and I can complement that by doing the surgical side once we can no longer treat a patient with the less invasive stuff.
While Andrew can get dramatic results with surgery, he's seeing a huge trend in people who want to look great without going under the knife. It's one reason the microneedling procedure Morpheus has gotten so popular.
It's a bipolar electrical current that goes from one pole to the other, positive to negative charge. And with that, it creates a heat. And with the heat, you can get skin tightening by tightening up the collagen. What's nice about Morpheus is that it goes deeper than other products on the market. Most microneedling devices go anywhere from 3 to 4 millimeters, which is just hitting most of the skin. With Morpheus, it goes to 6 or 7 millimeters. And so it'll go below the skin and get some of that fat and melt a little bit of the fat too.
And while most procedures target just one area of the face and the neck, Morpheus targets multiple body areas, tightening them up. Today, Dr. Pareto is seeing Christina, a patient who recently gave birth. Now she wants her
Patients that are in their 30s to 50s, or some patients that just look great and they're really not quite ready for a surgery, or maybe they're scared of a surgery.
It usually takes anywhere from a few weeks to a few months to see complete results, but once they kick in, they're very noticeable. These before and after pics show a big improvement in saggy arms and knees, although one of the most popular uses of Morpheus is using it to achieve a non-surgical facelift.
It's not the traditional scar that goes all around the ear, but just poke holes throughout the whole face that all pretty much are non-visible scars, and you can really tighten the skin of the face and really produce a nice result for patients who really aren't ready for a facelift yet.
Dr. Pareto says you can expect your new look to last 1 to 3 years. From head to toe on small spaces and large, Morpheus is the procedure more and more people are asking for by name. So, Rosanna, you have to do your due diligence no matter what procedure you're thinking about getting, whether it's non-invasive or invasive. You really need to shop around, ask questions, make sure that you're comfortable with what's going on.
You know, it's so funny because, you know, you talk to one dermatologist, they say, yeah, that Morpheus works. You talk to another dermatologist, they say, no, it doesn't. Don't spend your money on it.
Right.
So, I mean, you really got to do your own homework.
Exactly.
Because
it's up to you to decide what you feel comfortable with, how much you want to pay for those services, and if you think they're really going to work for you.
And you know what? I did talk to one plastic surgeon who told me, he said, if you want dramatic changes, you can try all this stuff.
I know what you're going to say.
It's not going to change anything. You got to cut.
Yeah.
Sadly, you got to cut.
You got to slice and dice and then deal with the scars later.
Yeah.
So maybe I should do something on how to deal with the scars when you're done, because I know a lot about that too. Yes, all kinds of oils and lotions and potions, you know. I try a little bit of everything.
Well, listen, you look fabulous.
Well, thank you.